Hey everyone, Joseph Shapiro. Thanks for joining us. Joseph Shapiro, co-founder of Psychedelic League. We have Sara Price and Heather Shelton. Thanks for joining us. Looking forward to today's conversation. I'm going to hand it off to Sara. Again, Joseph Shapiro, I'm an attorney in New Jersey and co-founder of Psychedelic League with Sara Price.
Hey, thanks so much, Joe. Sara Price, and I am a registered nurse and functional medicine nurse coach, and which is why I'm so excited to have Heather with us today. She is a fellow nurse and a retired nurse, and also an herbalist who worked with botanical medicine for 25 years. She provides consultations that include herbal medicine, cannabinoid therapy, nutritional guidance, and healthy lifestyle changes. Heather blends her botanical medicine experience with her traditional nursing experience to offer a unique holistic approach to care. She's committed to working with mind, body, and spirit and is excited to support others on their healing journeys. Heather started her journey in psychedelic care as a ketamine nurse. She's currently an instructor for psilocybin facilitators at Subtle Winds in Oregon and works as a licensed facilitator at Epic Healing Eugene, which is the first licensed psilocybin center in the country, and she helped open it with its founder, Kathy Jonas. Heather's a member of the United Plant Savers, the International Association of Psychedelic Nurses, the Cannabis Nurses Network, and the American Cannabis Nurse Association. Heather has a deep commitment to the earth and serves as a board member to two nonprofits, the Northwest Land Conservation Trust and Fox Hollow Forest Land, where she stewards land and leads workshops on herbal medicine, self-sufficiency, and earth-based traditions. Heather, welcome. I love that your background has such a plant focus in general, especially as an herbalist. I'd love to sort of start the conversation off with diving a little bit into your work with with Epic Eugene.
Mm-hmm.
And, so you're a facilitator in that locate with them, correct?
I am. Yeah. I've had my license for a couple of months now. I actually was working with Epic Healing just kind of as part of the creation team once we received our license. And I wasn't, because I hold a nursing license, I was a little tentative actually about becoming a facilitator and having a license in that realm as well. We don't have a nursing scope of practice for psychedelic work here in Oregon yet. So it took me a little while to kind of decide what was the right path for me. And I have retired my license at this point now, my nursing license. So I'm just working as a facilitator.
Interesting. Are you finding that are other nurses in this space doing the same thing just as a cautionary thing? Was it a little bit more of like a personal I think I want to just be extra cautious here, or what sort of led to that?
Yeah, there are quite a few nurses who are facilitators in Oregon who also are still keeping their nursing license. In my case, working as a cannabis nurse for the last decade, it was a little tentative here because, again, also we didn't have a scope of practice for cannabis nurses in Oregon. So I had felt ethically really that I'm doing the right thing to work with clients, even though I wasn't sure the state board approved of that. So for me, it just felt more comfortable to work in one realm over the other. And to be honest, working in modern medicine, healing is really different. It's often pharmaceutical driven and leaves spirit and the whole being out of the picture. So it's pretty fulfilling doing this work where I'm really able to help people in a deeper way. So.
That's really beautiful. That's really beautiful. Do you know if there are any situations or other nurses that you may know who have heard anything? Have they been kind of pinpointed by the State Board of Nursing, or is it just kind of like they're turning their...
Yeah, I haven't heard of any cases of that. And we actually got a new president of the board recently, and I know that she is more supportive of Measure 109. And I know she's actually, I think just yesterday, Oregon approved a scope of practice for nurses in cannabis care. So we're moving forward really rapidly. I'm hopeful that nurses will be able to work in this field without having to worry about discipline. I mean, the way that legislation is written here, or the regulations, is that when we're working with our facilitator license, you're not allowed to work under any other license. So really, we're trying to keep those two things separate, although we can never remove the nurse from the nurse. So we always have that background and those skills that we bring in.
Oh, interesting. I know like New Jersey is in writing the bill and in the work that they're doing is trying to make it so that like physicians, for example, like the state can't take away their license for working with a Schedule One.
Yeah.
One
And I
drug.
think that's very important. So I'm really glad that that's already being discussed.
Do you know, is there something similar in Oregon work from a medical from at least an MD perspective or other?
I don't know. I don't believe that we have anything in place for medical doctors yet either. Yeah, but I do know we have some facilitators in the state who are medical doctors.
Oh, wow.
Yeah, one who's on our faculty. I don't believe he's still practicing medicine, but he still has a license. Yeah.
Oh,
So,
wow.
and it's beneficial, I think, for clients to have facilitators with all backgrounds. One of the things when I talk to clients in intake and they're curious about what facilitator they might want to work with, a lot of that I think comes from what are the goals of the client. So there are folks who come because they really just are curious and they want to have an experience and they want to see what it's like, or they're on a personal growth path or a spiritual path. And so I feel that really working with a facilitator with any background can be really supportive that way, because the experience is actually with the person and the psilocybin, right? As a facilitator, we're really standing back. We're there. I started my career in home birth midwifery. And so I often think of my role as a facilitator kind of similar to a midwife, in that I'm present, I'm very aware of what's happening in the room, and I'm also allowing the experience to unfold for the person. And at the same time, I have skills. And if something comes up where there's a situation and a client needs support, then I'm very ready to, jump at that and be there for support in the way that I can and the way that I've been trained. So, we all have that training. Now, there are some clients who have had a lot of trauma in their background, or, had really dysfunctional, challenging childhoods. And so when folks want to come and work through some of that heavy stuff, I may encourage them to work with one of our trauma therapists, someone who really has a background in supporting people, because one of the things that can happen in a psilocybin experience is that it can bring up some repressed memories, right? Or for folks who come in with an intention specifically for healing some of their traumatic experiences, it's likely that there will be some triggers from those traumatic experiences coming up in their psychedelic journey. So the background is really helpful, and it's helpful, for me. One of the things that I see is I get a lot of nurses and medical professionals who want to work with me because I understand that background. And so we already come in and we have a common ground. I understand compassion fatigue. I understand vicarious trauma, because I've actually had those experiences myself. So the background is important. And also, I think there's a facilitator for everyone.
That's such an interesting point, and one I think that is helpful for states kind of coming online from this medical perspective to understand, because there's this idea that it needs to be some people believe it needs to be a psychiatrist or a psychologist or these things. But the reality is like we're all looking for something different in it. And, finding the facilitator that feels right for you and that you connect with is actually more important than, of course, if everyone is trained, right, and trained to support them, but having somebody that they sort of connect with and that they feel safe with, and that maybe they don't feel safe with a medical doctor or a nurse or anybody in the healthcare field, and they are looking for something else. So there's like really just illuminating the importance of that. There's not a right, perfect picture for every single person.
Right. Yeah, definitely. When we're talking about regulations, we don't want to put people in a box and say, oh, they can only work with this type of provider to have this type of experience, and all, because the experiences are so vast. And we know that every person is different in the way they'll respond to things. And definitely a lot of folks have medical trauma in their background, and they might not want to be in a medical setting or with a medical professional. And I think that is really important.
That's very cool. Very cool. And so you talked a little bit about like your intake process. I'd love to learn a little bit more about the intake process. Because I know, I think how things are going from the New Jersey standpoint, just to sort of pass along like what that picture is looking like, they will get a referral from a qualified person, whether that is a medical doctor or could be a therapist or a mental health care provider. But the screening happens with the service center and facilitator. So like what does the screening process look like with Epic Healing?
Yeah, so Oregon does not require having a referral to have services. So people come of their own accord, sign up on our wait list, and we reach out to them. And during an intake call, so we review questions. There are required questions from the state that are contraindications to having services. So one of those is using lithium within the last 30 days. Which actually then for me also leads to some additional questions, right? Because we want to know, why would somebody be on lithium? Even if they are actually weaning off, there's just some further questions we might want to ask. So intake can be really short, and intake can take some time. I prefer to take time with every client, also just to be able to answer their questions and make them comfortable. We ask about suicidality and self-harm. We ask if they have a history of psychosis. Those three questions are questions that if someone answers yes, then according to our regulations, then they get declined services. Now, I do like to delve a little deeper into some questions when people answer questions. And we continue to talk about this at the state level, because there's passive suicidality and there's active suicidality. And so we really want to keep continuing those conversations with the state. And amongst us in service centers, and what does that mean, and how do we serve people? And, there's still a lot of nuance and a lot of things we're figuring out. But since I brought up the state, I just want to actually make a comment, because one of the things that I've been really impressed with in this process over the last year is the support I feel like we get from the state. And what I mean by that is that they're really responsive to questions, and they're thinking about it and kind of figuring it out too. So I feel like there has been a really good collaboration between service centers and the state in rolling this out and what this looks like and how we can do this in the safe way that's really supporting clients in the best manner.
That's really, really great, especially if there's a quick response in terms of you have somebody who's, really trying to get in and I know you guys don't call it's not treatment in Oregon, but to have this experience and to be able to get quick response and clear guidance from the state in terms of how that can work. That's really cool. Question for you. And I think when it comes to the suicidality, does that mean that they cannot be actively suicidal, or they cannot have had any sort of suicidal ideation?
Well, that's part of the conversation, but there are folks who have active suicidality and then periods of time where they're not suicidal. So typically, if someone has a more complicated past, we really encourage them to speak with their therapist about it, maybe get cleared from their mental health provider to come and have a session. I think honesty is really so important in talking about in these intake calls. And what I find is people are appreciative of honesty. And when I ask questions, a little deeper questions, or talk about the concerns, well, here are the concerns that we have, right? These people come for these experiences because they're destabilizing, right? They take us out of our normal everyday thought pattern. And that is really effective for a lot of people. However, if we're going in and we're already in an unstable place, then having a destabilizing experience can make that worse, right? And so when I have those conversations with people, most people are so thankful that we're actually having the conversation, and they want to come and they want to know if this is a safe option for them or if this is the right choice. And of course, I can't determine that for someone else. But when I give them the information, then I feel like they can make a better choice. Yeah.
That's
And I'm going to go a little bit back to intake because those are 3 top questions that the state requires, but we also delve a little deeper as well. We do ask about antidepressant and anti-anxiety medications. We do ask if folks are on diabetic medications or weight loss medicines, because there are some things we've been learning over the last year about the effects of psilocybin with certain pharmaceuticals. So now we have these questions, and again, we're non-medical, so I can't give medical advice or medication advice, but I can let people know what has been seen in the research. And then also we have a list of providers who are psychedelically aware, that where people can actually get consultations to talk about medication interactions with a professional.
that's so interesting with the diabetic drugs. Are those more
Mhm.
like your GLP-1
Mhm.
agonists? Oh,
Yeah, and what we've seen is that they are so effective at delaying absorption that, people can take psilocybin and then not have any effects. So it's really recommended. I believe there's a service center, and maybe more than one. We have quite a few service centers now in Oregon that actually don't allow clients to come if they're on those medications. We encourage people to talk to their provider, to take a break, give them some, to wean off, because these services are expensive right now. And I don't want anyone coming who's actually going to spend money and time and put in the work, right? Because there's also work involved. It's not just the psychedelic experience. And then to not actually have an outcome, because that's really disappointing and it feels like a waste of their time.
that's pretty interesting. That's interesting that it's the delayed. Does it eventually hit, or does it just end up blocking absorption altogether?
You know, um, so from my understanding, it delays it so long, and that some folks do have a little bit of an experience, but it's just so mild, and 8 to 9 hours later. So yeah.
Wow.
Yeah, and I believe that some of the other anti-diabetic medications can do that as well, specifically the ones that do delay absorption. I don't think metformin's on that list, but again, those are clients that we would send them to their provider to have those conversations, or recommend that they see one of these medication consultants, because even though I'm a nurse and I know a lot about pharmaceuticals, we're a non-medical facility. Yeah.
Wow. That's
Yeah,
really interesting. So once they throughout that I'm sure you guys are learning so much over this last year.
so
I
much.
want to dive into that like specifically too. When it comes, so for a person who's coming through an experience with Epic Healing, they go through the intake process. And they do that with the facilitator that they're going to be sitting with, or do they do that through a set person at your location?
Yeah, so we now have a team. I was the team for a long period of time, and now we have a team of 5 of us, and so they could have an intake with any of the 5. Typically, really in part just because of operations and logistics. At this point, it's just the 5 folks in the intake team versus every facilitator. That could change as we move forward, but there's lots of pieces of the puzzle to figure out in order to make that happen. But all 5 of our intake specialists are facilitators also.
Gotcha.
Mhm.
Gotcha. And then they decide at that point who they want to have as their facilitator.
We do ask them to do that. And one of the things that you brought up earlier was trusting your facilitator. And so on our website, we send them all to our team page on the website, and let them know when you click on each person, it opens a whole new page for each facilitator. So there's a long bio, and we actually have short videos of each one of our facilitators, which has made a really big difference for clients. And you just get a feel for someone when you hear them speak a little bit, and our facilitators share what brought them to this work, the folks that they feel really inspired to work with. And so I encourage everyone who's wanting services to spend time on that website, really look at all of the videos and see who resonates with you, because it is important to have trust in the person that you're sitting with. That's really the only way we can allow ourselves to be vulnerable. So that is an important part. even back to, I'm not sure if this was before we got on or now, talking about how we have staff, who are trained trauma therapists. I'm a retired nurse. We have other active nurses on our team. And we also have folks with different backgrounds that aren't necessarily in the human resource field. And, for some folks, I may recommend they work with a trauma therapist depending on, the background of their life and the things that they want to come and work on. But really, what I tell folks is the most important part is feeling a connection to that person. If we're sitting with someone in a space and we don't feel trust with that person, then it's a lot harder to allow yourself to let go, right? And letting go is, I think it's one of the more uncomfortable parts of a journey for people, just kind of that initial allowing the experience to occur and letting go of control, right? We're here in the United States, we're pretty good at controlling things. We like to know what's going to happen and what it's going to look like and how long it's going to take and all of these things. And really, a psilocybin experience is kind of an experience outside of time. So it's just critical to feel safe with the person you're with to allow that to happen. So we do talk about that quite a bit in the intake call as well.
That's really cool. And I mean, do they have a chance to actually meet with the facilitator beforehand? Or do they sort of make that choice on the website and then move forward?
They usually make that choice on the website, and then talk with us in intake, and then we'll schedule with someone. Both our clients and facilitators reserve the right, and a preparation session if it does not feel like there's a good connection. We have a team. And so it may be that the facilitator thinks, I'm not sure this is a really good match. And maybe there's someone else that you might work with better. And we do all know each other. So that's helpful. There may be someone who comes to see me and I just think, oh, I think you're actually going to work really well with this facilitator here. So, and for clients as well. I mean, safety is of utmost importance for us, and feeling emotionally safe is what we're looking for. So yeah, we also do an intake. I'm going to keep going back to intake because it is so important. And there's a couple other things on there too. We do ask about cardiac history because we know that psilocybin increases your blood pressure and heart rate. And so the guidelines on that are as if someone can do moderate exercise, they're likely going to be fine with psilocybin. But again, if someone has, a complicated cardiac history, then definitely we will want them to see their cardiologist and get cleared by their cardiologist to have this experience. Let me think what else is on there. We do ask about diagnoses of bipolar and borderline personality disorder. It does not mean you're going to be declined services, but it does give an opportunity to ask more questions. There's a lot of folks who have diagnoses that may not be accurate, or they've had them at other times in their life. And then we do, now that we have a full team, which is great, and we do have a couple of therapists on our intake team, that if there's a complicated case or we're just not sure as the intake, then we take it to the team. And so that way, for us as facilitators, we all can support one another. And then we know that our clients are actually really receiving thoughtful responses and care to know that they're safe when they come.
I really like that idea of, that it's not just a singular kind of like person decision, it's collaborative and how to help this person. Yeah. Question for you. Have you come across, this idea of like sending people to get cardiac clearance, right? For surgery, that's a pretty clear look of what that needs to be. Right. Do you find that cardiologists are familiar enough with psychedelics to feel comfortable clearing somebody for that?
I don't really know because I'm not in touch with any cardiologists. So it's really the client going to see them on their own. We have had clients come who have been approved by their cardiologist and everything's been okay. This is a place where I will use my nursing background. If someone has new onset atrial fibrillation, or, they just had a cardiac arrest within the last year, I will probably use some of my nursing background to talk about the safety and the safety concerns and why it may be worth it to wait a little while to have this experience, all from a non-medical I mean,
Yes.
I am a little medical, but I'm definitely not giving medical advice, but I am trying to just really share with people the importance of safety and why I would want them to talk to their cardiologist, or why now might not be the best time because you just had that cardiac event a few months ago. So let's, give a little time for healing, and then we can have this call again in 6 months. And we certainly have had those where folks, are waiting for a period of time to work through something, whether that's, a pharmaceutical change or a health concern, but then they'll come back and then we can move forward with their session.
Yeah, that's it. That really, I think, illuminates the importance of, again, going back to that, like, across the board training for healthcare providers and like medical providers in general, about to learn the foundations of something about psychedelics, so they can give these clearances that they need, and then can help them whenever they come back in with whatever it is that their medical condition is. And like we talked about with emergency care as well.
Yeah.
Yeah.
And I think, I'll tell you that something I've been so impressed by, especially after working in the field of cannabis for so long, where providers really do not have a lot of information or education. I mean, most of our providers don't know that we have an endocannabinoid system, right? So that's a whole organ system that sadly a lot of medical professionals aren't even aware of because it's not been taught. We're not at that place yet. But what I'm seeing with psilocybin is, because the research is really being widely shared, is that almost every client who comes, when I ask about their mental health provider and are they aware that they're seeking psilocybin, they'll, pretty much across the board, people say, yes, I've talked to them. They're the one who sent me. They recommended this. They're supportive. I mean, I love to hear those responses. And that's psychiatrists and therapists and sometimes people's primary care provider. So it does seem like there's a lot of, there's so many more providers, at least from my perspective, of, the role that I've been in. I've been so pleasantly surprised at the awareness that doctors and therapists have about psychedelics.
Yeah, I wonder if there's data out there on receptivity of physicians to, psychedelic use in patients. Like, if there's any sort of survey that's been done, like, what is the temperature amongst healthcare providers in terms of making those recommendations?
Yeah. I haven't seen any, but that would be a really fascinating report. And helpful for moving forward, right? In states, and like in your state where you want, at this point, I think it sounds more like it's going to be a medical program. Is that right?
Yep.
Yeah. So it's important for us to know, well, are providers aware, and are they supportive, and what do they know? Because there's so much misinformation, and, psychedelics have had a pretty heavy stigma for a long time. A lot of people just think, oh, psychedelics, somebody's going to go crazy and jump off a roof, right? Everyone has that vision. I don't know. That must have been widely shared at a point in our lifetime.
It found its way into the collective consciousness.
It really did seem to do that, And so the stigma runs so deep that's part of what we really have to work through, just educating folks that psilocybin actually has a really incredible safety profile. And those situations that do turn out bad, often people have not been in a safe set or setting. They haven't spoken with anybody about trying these things. They're trying them independently with very little information, maybe with no support, So one of the things, I know you had sent me a question about, like, what have we learned or how have we shifted in the last year? And one of the things that we have done that I feel has been really helpful, and to be honest, all of us staff love it so much, is that we offer ongoing support. So we've increased the preparation offerings. Now we offer every client 2 to 3 hours of private preparation with your facilitator, 2 hours of private integration with your facilitator after the session. And then we have twice a month group preparation meetings, twice a month group integration meetings that we offer that are free to all of our clients. They're invited to come forever, especially to our integration. And we're just about to roll out. I think we just had our first group started this last month. We're doing a variety of kind of special topic groups also that we'll be inviting all EPIC alumni to attend as well. So there's one that's kind of on personal growth, more research oriented. We have one on other healing practices. We're having a group run by 2 trauma therapists that is more of a trauma support group. And then in later September, we'll be doing a group for end of life and grief care. So we're really, what we have seen is that people need more preparation, actually. And so that, there's why we've increased our offerings for preparation. And then also, what's required here in Oregon is 1 hour of preparation and offering an integration session. And, what we know at EPIC is integration is so important. I mean, it's really where the work happens, and so to not offer integration seems negligent, actually. And so, we offer each client their private integration and then these groups. And the groups are so amazing, just to see how folks support one another is really helpful. I learn a lot in group of what's working. I learn a lot in group, not only from a facilitator perspective, but also from a human perspective, because I also use psychedelics, right? I mean, that's how I got into this field. And so I've learned techniques from our clients that are helpful for me in my own life too. So it's just such a great support community. And also I think we live in a time where loneliness is really an epidemic. As much as we can be connected through the internet and you can see all these people and know what people are doing, that's not the same as having really a heart-to-heart connection. And these groups, I think, are a really great way for people to feel like they're able to have a connection with someone else who understands a big, important thing that's happened in their lives, because these can be really transformational experiences. And sometimes, and as we all know, they can be hard to describe in words. So to be able to have support and conversation with other people who have shared those experiences is really empowering.
It's really, Joe and I have talked a lot about that community aspect to this movement, to service, how service centers really have the ability to bring people together under this real unique, common amongst the people who come, like, experience, because it's hard to describe or even talk about to people who've never done it.
Right. And I feel, I speak to every one of my clients at the end of the day and just, give them permission to hold on to their experience, because if they've maybe shared with folks that they're coming for a session, people are curious. They have a lot of questions, but they're deep internal experiences. And so I like to give people permission to hold on to those. Just hold on to them until you feel ready to share. It's okay to say, wow, a lot happened and I'm still processing this. And then come to a safe space where, folks feel more inclined to maybe share about them because they know everyone else in the room has gone through something similar. Yeah.
I really love too that you guys are doing specialized groups for the community and for the integration work. It'll be interesting, for communities like, municipalities across New Jersey or across Colorado, like, if we end up collecting, if there's data to be collected from those, to kind of almost like continue to follow people, but also to see like the impact that continued sense of community has on like the community, the greater community as a whole.
Yeah.
There's something in there.
We're pretty lucky here in Eugene, which has been a more psychedelically experienced community for a long time. That there are already free integration circles that happened before psilocybin was even legal here.
Wow.
So, folks have a lot of access in certain areas. I'll say in Eugene, I know that we've already had ongoing integration circles. Up in Portland, there's a lot of them. In some of our more rural areas, I'm not really sure what's happening. I know in a lot of our rural areas here in Oregon, counties declined having psilocybin services in their area. So, there may just not be anything happening in some of those regions. We get a lot of folks from outside of Oregon who come for services.
Yeah.
Yeah. Which is amazing. I love to, I kind of think of it as the mycelial network. Somebody comes from, maybe Arkansas or somewhere really far away and has a psychedelic experience or a psilocybin experience. And then they're going to go home, right? And go back to their communities and hopefully after time feel a little more comfortable and just even sharing with one person, right? And then this is how the network spreads. And the more people understand it's not as scary as we've been led to believe, and not as harmful as we've been led to believe. And really watching people that we know and care about grow, right? Grow and maybe move past some patterns that have not been serving them. I mean, all of that is just waking people up to the idea that this is okay. This actually is a healing modality, and it can serve a lot of folks. So I like that part of when people come from afar, because I know that they're taking it back home too.
How do you help to navigate the continued community and integration process when people do come in? Because I assume we're going to see that in New Jersey, right? Of people coming from New York throughout the Northeast, if they end up passing this sooner than other states. How do you help maintain that integration process with those who are far away?
Well, all of our groups are online, actually. And because of that, because we do have such a big population that come from other places. So all of our integration groups we do online, so people can tune in from anywhere. That's a huge piece. Also, all of our groups that were these specialized groups are also going to be online. So, I've been really grateful for Zoom since the pandemic, and I'm still really grateful that we have that that option for us and different time frames that we can actually pull people together. So, we do talk about, as a facilitator in preparation, we talk with our clients about their resources. What are your resources at home? Who do you live with? Do you have friends in your community? What kind of resource, what is your community? What does that look like for you? Because those actually are really important things as well. And, we have certainly had some experiences where people are not well resourced in a community sense. And so, we may recommend that they wait a little while before they come and have an experience. Like maybe find a therapist and just step out into your community. And because when you come home, there's the psychedelic experience. And what I like to say to clients is that a lot can happen in these psychedelic or psilocybin experiences. And often what they do, they're a really great catalyst for change. So we can have a new perspective on things. We maybe can see a way that we can make a shift in our life to improve our lives or improve our community. The hard part is actually going home and then going through making those changes, right? And that is what integration is. And so it's really critical to have the support for folks when they're going through that part of the process. And also, another thing I like to talk about is often in the psilocybin experience and shortly after, we feel really expansive and open, right? I mean, most people leave with a big smile on their face. They're feeling really good, and just the natural rhythms of life. We have expansive states and we have contracted states, right? We have up times and we have down times. We're happy, we're sad. It's okay. So all these wide ranges of emotions, we're actually here to experience all of that. So I've learned the importance of actually talking with folks about that contracted space too, because, going home, feel really, really just kind of blissed out and wow, I have this new awareness and, I feel really good. And life's going to bring something that's hard, that makes us kind of like, oh, crap, did I lose everything I had in that experience? And we don't, right? So there's just I like to talk to people before that happens, before they have that contracted experience. Like, this is going to happen. This is how we are as humans. It's okay. Just know that just because you have a contracted moment doesn't mean you can't expand again. So, these are just some important things that I've found I like to talk to people about to help them through that integration process.
You know what? I think that you bring up a really important point, and this idea that, the integration is, there's the psychedelic experience, and the integration is where a lot of the work happens. And I think that a lot of people who've not experienced psychedelics, that word integration, what does that even mean? Like when we say that integration is where the work is, what does that even mean?
Right, right. So I do share, again, a lot of this happens in intake. Actually, we talk about a lot in the intake call. It's important, I feel, for people to really be well informed about what they're coming into. And a lot of folks have questions. A lot of people follow through. A lot of people don't. Say, well, I'm going to think about it. I'm going to think about it some more. And maybe at some point they'll feel like the time is right for them. But I'm glad they've had the information. Now they can kind of chew on that for a while. We have a pretty extensive resource page on our website, so I'll often send people there just to learn more. We have things on there. Kathy, who's our founder, we've done a lot of videos that we also have on our website where we talk about different mindfulness activities. We've done one on meditation. We've talked about preparation, things you can do to prepare for the experience. So we try to provide a lot of resources for people. And, the folks who use the resources and kind of do their homework, I won't say they have better outcomes than others, or I haven't really sat down to look at that, as data wise, but definitely doing the homework and being well informed and doing some of these mindfulness practices, I have seen how they support clients. I have one that, well, we all do this, I think, in our group. We definitely do it in our groups, and I like to do this with my clients. Most of us are really in our head. That's just how we act. That's how we work here in this country in particular. And one of the things psilocybin does, it actually kind of takes us out of our head and puts us into our heart space, right? This is why emotions come up for a lot of people, why you can have some intense, crying experiences and purging experiences. A lot of us are not in tune with our heart space, right? So one of the activities or homework I kind of like to give people is just, let's practice that. I mean, we could practice it right now. There is something that happens when you actually close your eyes and you put your hand on your heart and you focus your breathing into this part of your body. Physically, it creates a new sensation. It can bring up tears for some folks just breathing into this space here because it's been so long since they've done it. And so, I like to encourage folks to just start that practice in preparation as they get ready for their session. And I love this. And I see this often when someone's in their session, really deeply in, not talking with me, but really internal, putting their hand on their heart, And so, and doing that practice and then going home and having that practice and living from the heart space really can change your life. Getting us out of our head. I mean, anxiety is all in our head, right? And it's all about thinking about what's coming next and worrying about what's coming next. And when we're in our heart space, we can be really present in the moment. And so when we're really present in the moment, we experience gratitude. And there's just an elevation of how we feel in our life. So, that's just this little action, really, right? And it doesn't take much time in the day. And so, preparation in that way is also really important, of just what are these skills that we can have? How about practicing deep breathing? Because when something challenging comes up in a session, depending on our personality and our experience with psychedelics, which a lot of folks come who've never had a psychedelic experience, come for psilocybin. If something unsettling arises, then, and they've already done some of these practices, then when I can remind them, let's go back to the breath. Just take a nice deep breath and get yourself centered. And if we've already practiced that, then it's much easier to fall into that, especially even when you're under the influence. So the whole package is really important. There's so much emphasis on just that particular moment, which is very important. And especially kind of at the state where you are in legislation, that part is important. But there's so many other pieces of actually the whole healing experience with psilocybin.
Yeah. That's really, go ahead, Joe.
Yeah, I mean, to that point, I think it's hard for legislators in particular who don't have any experience to understand that it's a different paradigm, right? Like,
Yeah.
because especially where we have a medical model, which I think can be appreciated in a lot of ways. I think maybe perhaps some of so your center's clients might appreciate the idea that it's more structured
Yes.
and it's certainly legal, but that brings in a paradigm of maybe, at least in New Jersey, with the pending legislation, that it's medical. So you have legislators thinking it's a medical procedure, I've heard it said. But then how do you integrate all these things that we were just talking about, which are so important? So I think the
Right.
paradigm, and I'd wonder how you could, in an elevator pitch, from your experience, how do you explain the difference or the distinction? Or, I think that's part of the mission of the Psychedelic League, is getting that in an elevator pitch that we can make, that's like truthful and accurate, and and both, and it walks that tightrope between, yes, you have medical clearance, but once you're there and you're in an experience, the facilitator themselves isn't really, they're not your medical provider at that point at all. They're there to guide you, and it's not a procedure at that point. So you have parsing these two paradigms is challenging. So
Yeah. Well, one question I would have really in thinking about the medical model is, will providers be doing like therapy when they're working with clients under the influence, right? Here in Oregon, we have to use a non-directive approach. So we're not really guiding people in the journey. If something comes up for someone, I'm not going to be I'm not going to ask in-depth questions about their past history or their trauma. That's not my role. My role is to help support them to be curious, to ask some more questions, to really offer them the support to go through that with the psilocybin. And if need be, then maybe to maybe redirect them a little bit, or say, hey, let's just take off that eye mask. Look around. You're here in Epic. You took some mushrooms. The mushrooms are working. You're safe. I mean, and then people can put their eye mask back on and actually that be in a different place, so it can be that simple. So one question I would have is the vision in New Jersey that clients will be working with providers who actually kind of be practicing therapy with them, or are they going to be able to sit back and allow the experience to unfold? What is the expectation? I don't know if you know
It
that
is
yet.
a non-directive.
Okay. Yeah. So that's interesting. And then people would have to have a medical license of some sort to be a facilitator. Is that?
No,
Well,
so
that's the interesting thing. Yeah. Well, yeah. So there's a gatekeeping mechanism in New Jersey's legislation where you're going to go through a physician or a psychiatrist, or there's a list of other titles, including licensed clinical social worker, who has a patient under their ongoing care. And that person is going to then make a referral to go to a service center where a facilitator will facilitate. So at that point, you've gone to the gatekeeping mechanism and you go to facilitator. And then I think it picks up where Oregon, then you're essentially kind of following Oregon's model at that point. The facilitator wouldn't be giving any medical advice. And effectively, it's kind of like what you've just described, but only after the person's gone through the referral process under the person who's giving them ongoing care.
Mm-hmm. Yeah. So that, I mean, I would say then kind of the big hurdle is to those providers need to be educated, which if they're psychiatrists and social workers, they're probably already well aware of the research that's coming out. But medical providers probably are not as aware. So however, whether that is that the state requires maybe all providers to do a brief, psilocybin education training, that's something even they could do online, just to at least get the basic information would be important. I know in a lot of medical cannabis states, well, in some medical cannabis states, they do require that of doctors who are going to sign cards for patients. And in other states, there's nothing, there's no education, which leads doctors to be less likely to sign medical cards, right? If they don't know what they're signing for, they're less likely to sign it. which is smart of them, actually. But that's going to be an important piece to have happen if you're required to have a referral from someone. And then the other question is, who would do the integration? Do they go back to that provider? Are there special, does the facilitator do some integration? Will they be required to go to a therapist for that? Our therapists and even medical folks like me in integration, again, we're still, we're not practicing therapy with our clients. So that would be something, we do have a list of psychedelically aware therapists that folks can see. There's great lists out there, and Psychology Today website and whatnot, where people can find support. It is helpful to have your therapist, provider, doctor have some education about psilocybin. It has an incredible safety profile. And that would be the other thing that I'd make sure was in the medical information that, doctors are receiving, is that psilocybin actually has a really wonderful safety profile.
Yeah, I think in New Jersey, the way it's written as right now, and it's still, of course, a working document, is that they will have an integration session with the facilitator, and then would also have a follow-up with their therapist. And again, I think that this is going to be interesting to see how, the regulatory board kind of implements that, because having a therapist follow that up who is aware of psychedelic aware to understand those experiences and to be able to work them into their long-term. So I think that there's still going to be some more clarity coming from that, but there is the initial integration is with the facilitator. So it'll be,
which I think is really nice. I find that people, they're excited to come to integration and just kind of share about, even sometimes clients will come in and have a session and they have their eye mask on and they don't say a word for the whole time. So I know nothing really about what happened, except for what they share with me. But when we come back for integration, they're so excited to share like what's happened since they got home and what are the changes that they've noticed. And they sometimes may sound like they're small changes, but they're really significant. And one thing I heard, this is probably what I hear most often, is that what folks find is that they are no longer just reacting to situations, but they actually are able to put some space between themselves and that moment and then respond appropriately. So, across the board, this is something that people have found that it just, and which is so amazing, right? We all need that. We all need to create a little more space before we just react to something, because then we can actually sit with it for a moment and respond appropriately. It's going to improve communication. It's just going to improve everybody's feelings in a situation, right? And so I love that. I love that that's the outcome, or a outcome for most people that we see, because that just leads to a better quality of life, and we're not just reacting to everything.
How would you describe, for someone who knows nothing about psychedelics but understands that psilocybin has a good safety profile and is effective as a treatment, especially for like the tip of the spear treatments that you hear about, like PTSD and
treatment-resistant depression, yeah,
right, which are all really compelling, and you hear a lot in advocacy for legislation that it's a breakthrough therapy. It helps veterans and first responders. So then it really gets built up that it's an effective therapy. So then the question becomes, especially with a gatekeeper, like a medical gatekeeper, like in New Jersey proposed, how do you then differentiate what a facilitator does, and why shouldn't it all be done, with cost aside, why shouldn't it all be done by a physician? I think that's the question that we are faced with when we're talking with mayors and town council.
Mm-hmm.
That's who Psychedelic League is primarily engaging with. That's the mission, is to help on the local level, help the towns and their communities understand psychedelic businesses so they can better operate and ultimately have more beneficial time, place, and manner restrictions, which we know affect where the businesses can operate and how. So, we've heard we've heard some legislators ask, like, well, tell me, why does a facilitator only need a high school education? Like, shouldn't they have a MD or a DO? How would you respond to that question? Like, for instance, if you were talking with a mayor or a legislator?
Well, one thing I would say is that I actually think it's really important for facilitators to have had their own psychedelic experiences. And it's really hard to require that because it is a Schedule I drug and illegal in most places. But there is, I've yet to meet someone who can really accurately describe the experience of a psychedelic, having a psychedelic session. And so the way that we actually know the most about it is to experience it ourselves. And I know that's not probably the best scientific answer for legislators. However, that is a really important piece. And the other piece about the medical community, which I very much appreciate medicine. I was an emergency room nurse for a decade. I've worked in infusion clinics and labor and delivery in a variety of fields. But it's a really different model. And, medicine is not holistic. It does not actually look at the whole person. It does not take into account people's emotional and spiritual health. Often it has a lot to do with their physical health. And these experiences are tapping into people's emotional and spiritual health. And spiritual isn't even a word we use in medicine, right? Except it's like an idea over there on the side, but it's actually not part of the practice. And so for me, that is where I would actually want my physician to have extra training in the role. If they wanted to become a facilitator, I think it's important for them to understand that piece of the puzzle. This is not just a pharmacological experience, and it's not going to be written down with clear instructions in a book or a manual. There's actually a lot of intuition involved in sitting with someone. So I think that when we're looking at facilitators who maybe don't have a background in medicine, often they do have a background in psychedelic experience. And that is really valuable. And I would also just add back to this medical trauma piece. I'm actually someone who has experienced personal medical trauma as a young person, as a child and a teenager. And even though I've worked in medicine, I have a lot of trust and faith in some doctors I've worked with or know personally, but I would not want to put myself in that vulnerable position with a medical provider. And I think there's a lot of people who also would feel that way. So really, who do we want to have access to these medicines? I mean, I would say there's a lot of folks who suffer from mental health issues who don't feel comfortable or safe going to a doctor. I mean, and those are the folks that we're actually really trying to support, right? So a therapist background, social work background, I don't think that it has to be required, but certainly folks who are working more in those kind of caring fields would be a more appropriate choice than a medical doctor, except for maybe a psychiatrist who's actually studied, human emotions and works in that realm too. And that's not to put down doctors. So I just want to be really clear. I love doctors. I have so many doctors that I really honor and appreciate.
No, we do as well.
Yeah.
That's a perfect answer. And I think we're going to borrow that, if you don't mind, and use that as we speak with more and more people on the local level. Well, it's 3:00 now. I don't want to keep you too long. Really appreciate your time. This is wonderful, as always. It was, since the first meeting, I don't know if it's been like late last year, just been really impressed with what you're doing. And, you describe it's really like a pleasure to speak with you. I really think what you're doing is wonderful. So thank you for your work.
Thank you. Yeah, we're so honored to get to do this work. Really, it's been amazing. And from a nurse perspective, it has been so freeing for me to be able to talk about it openly. Because these plants, all plants for me, I love all the plants. All plants are a gift. And some of these master plants, as we may call them, or fungi, which is what this is, they've been on this planet a long time. Human beings have been using psilocybin really as long as there have been human beings. So it's not new. It's just us remembering something that we've already had access to. So
I love that.
yeah, I really appreciate what you're doing, because I've got family in New Jersey, and I want to support this happening in New Jersey as well.
Oh, wonderful. Yeah. Yeah, and we know that everywhere where there might be a psychedelic legislation is going to need, this information so they can educate the mayors and the town council and the zoning board where they're going to be setting up shop. So thank you for sharing.
Yeah, great. Well, hopefully I'll see you again sometime soon, and keep doing all the good work.
Same. Thanks again. We'll talk soon.
All right.
Take care.
Thank you both. Nice to see
you, Heather.
Thank you.
Bye.